Hello health friends. Many people want to lose belly fat and back pain. If that includes you, it's essential to watch and understand this video. This isn't just a simple 5-minute exercise video, it's much more because understanding how and why to do these exercises is crucial. This video is based on the latest and accurate science. If you want to master your health by understanding how the body truly works, make sure to subscribe and hit the notification bell so you don't miss anything. Firstly, even though we strongly support exercise, it's not the primary method to burn belly fat. Belly fat is primarily a metabolic and hormonal issue. If you're aiming to transform from the top picture to the bottom picture, workout alone won't achieve that. So, why are we making this video on exercise and belly fat? Because there are tremendous benefits to exercising, but also because there are many misleading, incorrect, and even dangerous videos out there. These videos mislead viewers by implying or guaranteeing rapid results with just a few minutes of exercise per day. This is completely false. They are incorrect because half of the exercises they suggest do not target the belly muscles. Most importantly, they are dangerous because the people demonstrating these exercises are often young and fit, never having experienced injuries. If you have belly fat similar to the top picture, you're likely not 20 years old or super fit. Doing these exercises incorrectly is more likely to cause injury and back pain than provide any benefit. In this video, you'll learn the correct approach to safely and effectively target belly fat, understanding the why and how to get results without injuring yourself. To start, we need a basic understanding of anatomy because knowing where muscles are and where they attach is crucial for effective exercise. The main muscle most people want to target in their stomach workouts is the rectus abdominis. This muscle attaches to the sternum, chest bone, and the lower ribs at the top, and to the pelvis at the bottom. Additionally, the abdominal oblique muscles assist with rotation, contributing to a toned, flat stomach. The key thing to remember about muscles is that they can only contract, meaning they get shorter when they work. They can't push or extend on their own. To work a muscle, you need to bring its attachment points closer together. For the abdominal muscles, this means bringing the lower ribs closer to the pelvis. Chiropractors have treated thousands of patients with low back pain. In most cases, the cause is tight hip flexor muscles, the iliopsoas, and weak abdominal muscles. The iliopsoas muscle attaches to the lower spine, from L4 to T12, and the pelvis. When activated, the hip flexor brings the knee closer to the chest and also pulls the pelvis forward, which can stress the lower back. A strong stomach muscle helps counteract this motion by stabilizing the pelvis. However, if the hip flexor is stronger than the abdominal muscles, it can cause problems. There are 3 main reasons the hip flexor can become overly tight. 1. Sitting for long periods, such as in a desk job. 2. Driving, which involves sitting and repeatedly activating the hip flexor by moving the leg from the gas to the brake. Both of these activities can contribute to tight hip flexors and exacerbate lower back pain. The right and wrong way to do sit-ups and abdominal exercises. Many people perform sit-ups or other abdominal exercises incorrectly. Let's analyze a few popular YouTube clips to understand what's really happening. In the first video, the individual lifts her leg closer to her trunk. Because her leg remains straight, it acts as a long lever, putting a significant load on the hip flexor. As the leg is lowered, the back arches because the hip flexor pulls the low back upward and forward. The abdominal muscles work passively to resist the arching, but the primary work is done by the hip flexor. In the second exercise, both legs are lifted simultaneously, which increases the strain on the low back as it lacks ground support. Effective abdominal exercises require bringing the pelvis closer to the chest, which isn't happening in these movements. Instead, they overly work the hip flexors, which isn't beneficial, especially after sitting for long periods. Another example shows the hip flexor working hard against gravity, with no movement of the pelvis toward the chest. The abdominal muscles work passively while the hip flexor, particularly the PSOs, becomes stronger than the abdominal muscles. A different exercise does engage both the hip flexor and abdominals. There's a moment when the individual curls up, lifting her hips off the floor, which works the abdominal muscles. However, when her legs extend parallel to the floor, her back arches due to the strain on the hip flexors. As fatigue sets in, she starts jerking her body, causing more back arching since her abdominal muscles can't counteract the motion, which is problematic for anyone with back issues. Lastly, the full sit-up works both the abdominals and hip flexors but stresses the hip flexors more. When she arches her back on the floor and then whips her arms forward, it creates a sudden pull on the spine in an already arched position, which is traumatic for the lower back. Conclusion. Hopefully, this analysis clarifies what not to do and how to avoid injury. The next question is whether these exercises work for burning belly fat. The issue is mostly metabolic. These women in the videos likely never had metabolic problems, so their exercises focus on toning and fitness rather than burning belly fat. For significant belly fat reduction, about 95% of the solution involves lowering insulin and cortisol levels by reducing sugar and carbs, stabilizing blood sugar, and reducing stress. Exercise contributes only 5% to fat loss, but it's still essential because of its numerous other health benefits. Core muscles stabilize the spine, which has many muscles providing critical input to the brain. A strong and flexible core sends more signals to the brain, stimulating it through daily movements and keeping it active and healthy. Here is the training program that will melt the belly fat and are safe to perform. We have two types of exercises that complement each other for maximum belly fat melting. We have one for low-intensity aerobic workout for belly muscles and one high-intensity training that will activate the growth hormone to melt fat and keep insulin and cortisol low. We will start the workout program with 7 exercises you can do at home. Each, 1 minute, low intensity. We have made it easy for you with a timer. Do this program every day or as many per week as you feel comfortable with. After this exercise, we have high-intensity interval training. Enjoy.
Exercise 1, plank, 1 minute. 3, 2, 1. Go.
Se fechou a distância.
30 seconds.
Nunca importou nem o vento, nem o mundo ou o tempo. Sempre
3, 2, 1. Stop.
Next exercise, abdominals brace. Laying in your back, you put your feet flat and your knees up. And if you relax your back, you'll notice there probably be a little gap under your lumbar spine. On your low back, so first thing you do is you push your back flat down on the grounds. Your whole spine contacts the ground and then you tighten up your abdominals and you increase the pressure downward as if there was a scale there. And you're trying to put some pressure on it. So you start with your back flat, you tighten up your abs and you press your low back down against the surface. And you hold it for about 15 seconds. You can increase the pressure as you get more used to the exercises. Do 15 seconds at a time. Rest a little bit and repeat 4 times.
3, 2, 1. Go. 3, 2, 1. Stop. 3, 2, 1. Go. 3, 2, 1. Stop. 3, 2, 1. Go. 3, 2, 1. Stop. 3, 2, 1. Go. 3, 2, 1. Stop.
Next exercise, you start with your back flat again. And then slowly slide your hands up on your thighs, toward your knees. You want to do this as a slow, continuous motion without any jerking. It's going to feel easy in the beginning, but you will sure feel the burn if you keep going. Try to do about 20 to 30 repetitions during the minute.
3, 2, 1. Go.
Lua no céu, sempre tão linda e tão distante. Lua no céu, sempre tão leve e tão
30 seconds.
Me lembra quem eu sou, me leva para onde eu sei que vou me encontrar. Me lembra como amar, de parar pra respirar, pra respirar.
3, 2, 1. Stop.
This is a diagonal crunch. We bring the elbow up to the opposite knee, so we're bringing the rib cage closer to the pelvis, and we're getting a very good isolation. We're also making sure that the back is flat against the surface, and that we're performing smooth and controlled movements.
3, 2, 1. Go.
Lua no céu, sempre iluminando romances. Faz do sol teu romero, mostra o que é ser mais do que amantes. Me lembra quem eu sou,
30 seconds.
para onde eu sei que vou me encontrar. Me lembra como amar, de parar pra respirar, pra respirar.
3, 2, 1. Stop.
Now we add in some lateral flexion or some bending to the side. Again we start with the back flat and then simply reach down and to the heel on the same side. This motion provides some really good signals for the brain, and it helps restore range of motion to keep your spine flexible, especially if you've had some back trouble before. It's a good way to gently get back into it.
3, 2, 1. Go.
O jeito que você me conquistou, tão de repente, aonde você quiser ir, eu vou sempre. E pode crer que pra cada porta que a vida
30 seconds.
tocar, acho uma janela pra você pular. E cada tristeza que você sentir, acho uma razão pra você sorrir, amor. Pode contar comigo que eu vou contar sempre comigo.
3, 2, 1. Stop.
Next exercise. You start out with your back flat, then you put your knees at a 90-degree angle and you lift them straight up toward the ceiling. If it isn't moving at all in the beginning, don't worry, you may have to work up to this one, and also make sure that you don't compensate for lack of strength with trying to jerk or jump into the motion.
3, 2, 1. Go.
Onde quer que você for, se joga, que cuido de você, meu amor. Conta sempre comigo, sei que eu vou. O jeito que você me conquistou,
30 seconds.
de repente, aonde você quiser ir, eu
3, 2, 1. Stop.
Now we have one high-intensity interval training, HIIT, 15-second intense workout 15-second rest. Repeat 4 times. 2 to 3 times per week. This will activate growth hormones to melt belly fat. We will show jumping jack. You can use other exercises that you feel comfortable with, for instance, indoor biking.
3, 2, 1. Go. Three, 2, 1. Stop. Three, 2, 1. Go. Three, 2, 1. Stop. Three, 2, 1. Go. Three, 2, 1. Stop. Three, 2, 1. Go. Three, 2, 1. Stop.
Great job. See you in the next workout.